Well, holy Harry, did Harry Reid just let his party's real health care plan out of the bag? Hi, everyone. Glad to have you. I'm Neil Cavuto, and it looks like the Democrats' goal all along was to bag private health care in America. Now, that's not me saying it, even though I have often said it. More on me later, my favorite subject. Now, back to the Senate Majority Leader and what he was saying when asked about whether he was actually working to scrap our present health insurance-based system.
ObamaCare is a step in the right direction, but we're far from having something that's going to work for.
So eventually, though, you think we'll work beyond the insurance system?
Absolutely, yes.
Did you hear that? So goodbye, private health insurers. Hello, government-run health care. But don't say I didn't warn you. I suspected, and Dave, I'll raise this with you, when I was covering the vote and the debate on the Hill, that this was ultimately the goal anyway. And even though that some Democrats had expressed disappointment that we didn't end up getting a single-payer system, that it was like a Trojan horse deal ultimately leading to that. But enough about me. Back to my panelists who want to congratulate me. By the way, they were also in on this themselves, and they're smarty pants in their own right. They saw a lot of this coming. Take a look.
And ultimately, that's the game plan into a single-payer system. That's going to be a disaster.
With the public plan, what it's going to do is increase costs for people who still have private insurance.
All right, to our soothsayers, Charles Payne and Dagan McDowell, along with Adam Lashinsky and Gary Kalpam. All right, Charles, you were saying the signals were there, and now we're getting the confirmation.
Now we're getting the confirmation, and it's going to be a painful confirmation process because ultimately, when this happens, we're talking about pushing out the private sector. We're talking about all of our worst nightmares with respect to this kind of stuff. The prices are going to go up. The quality is going to go down. Innovation is going to be thrown out the window. You know, when people diss the private sector, they need to understand where we are as a nation, where we've come from, and it's been because of the profit motivation, in my mind, that we're as healthy as we are. People say, well, they live longer in other countries. Yeah, but we're the fattest, happiest country in the world, and I think we're doing pretty good because of the medical system.
By the way, the word is calorically challenged. Dagan.
If you're a conspiracy theorist, then you would believe that the current Obamacare, as it was written that way to be so unwieldy, to make it so you can't implement it, that people will hate it so much that you do end up going to a single-payer system where a Democrat like Harry Reid can point to Medicare and say, hey, that's what we need. We need Medicare for all. That's what you've heard from other Democrats in Congress. Maybe that happens, but there's so many people fighting the idea of a single-payer system. It flies in the face of everything we believe in.
Yeah, but if you get fed up with your insurance premiums, and who knows it better than back in your home state of Florida, where they're going up and in some cases doubling, you might run away from that private insurance happily, right?
But in the long run, single payer is going to kill. Just remember, the definition of single payer is they run the purse strings. They in and out the money, and that's what these people care about. The problem with all this is these are the people that created $17 trillion in debt. These are the people, Medicare, Medicaid, Social Security, how those things are doing. And you said it best, profit motive. There is no profit motive when government's running it, and it's just going to blow up. We already know the health care bill. They've had to cancel things, postpone things. The price of it is double what it originally was. Taxpayer, you're dead.
You know, Adam Lashinsky, I don't think anyone is ever that clever or devious, but you could argue that, you know, having 30 million who are not insured, suddenly insured, those with pre-existing conditions get insured. Kids stay on your policy till they're 80 or whatever it is. That you know, I'm joking, it's 26. But you would know the math and know that premiums would go way up. And you would know that people would get very annoyed by that. And you would know that that would push them into the very thing you wanted all along, wouldn't you?
Well, it's an interesting conspiracy theory, Neil. I'll tweak it a little bit, and I'd say there was no secret that a large segment of the Democratic Party, or some segment, I shouldn't say large, I don't know how large, was in favor of a single-payer plan for good reason. You know, Charles, I think, made a very good point. It gets down to values and what you believe in. I'll offer you an example. We have a single-payer military in this country. We've decided, really, the government should pay for all of it because we want our country defended well. Not sort of, not most people defended, but everybody defended. That's what people who favor a single-payer health plan favor. Everybody getting medical care in this country. But I don't think that Harry Reid tipped his hand. He tipped his hand a long time ago.
Number one, everybody already gets medical care in this country, that you can go to a hospital and get that very thing. The thing that people disagree with is the government making all of their health care decisions, in essence, where you will wind up with a financially unstable, untenable health care situation or a system. And then they're going to end up, the government will end up having to ration care. There are no two ways about it. That's what will end up happening.
You make
people
a good point, which
that.
is that people can go to the hospital and get care. And we're all agreed that that has worked terribly. That doesn't give people the sort of, preventive care that they need. It's extremely expensive. And I just want to say, as I've said many times, insurance equals rationing. All insurance companies, mine, yours, they all ration to an extent. They say, no, you can't get that procedure. Yes, you can get this procedure. We'll only pay
by the way, Adam,
so
when
much
it's just
for that
one guy
procedure.
doing it,
That's the
when
way it
there's
works.
just one entity doing it, when it's just the government doing it, there goes choice. But I'll leave that aside. I'll also leave aside the military healthcare analogy with branches of the military, and they have a track record that seems to be fairly successful. The government on other matters, I don't know so much. But Gary, where are we going with this? And with between the delays and between polls now showing that most people don't like the direction that it's going in, that we upended a system for which 90% of Americans were perfectly happy to cover the 10% who now, even now, aren't eager to sign up for this. For what?
I'll give you one number. Where are we going? Depends on 2014. The elections are going to be very important. If the Democrats get the House, they're going to be able to push this forward much quicker. And look,
you'll never get this president to sign off on signing off on this
right,
thing.
but at least they can at least fight it in a way. I don't know what way, but at least fight it. And look, my problem is the dollars with this. I would not trust Harry Reid to run my kid's lemonade stand yet. We're entrusting these people that have never run businesses.
Actually, when you think lemons, I mean, he might be the guy.
My point is,
he can do a good job taxing
this is a big part of the economy, and all of a sudden they're going to run it and run it well and run it profitably and carefully. My goodness,
he's not an administrator. That's not a fair statement. He's a legislator. He's not an administrator.
Fair
no one's
but he
him
is
to run
overseeing
anything.
the guys who will and implementing the programs for which
and
we'll
his
have
buddies.
this discussion.
No more so than before.
Well, fair enough. I guess what I'm getting at, though, is that we have a monster system that has now left the train station. Democrats argue you just can't bring that train back. We already know the train is significantly delayed, if not close to getting derailed. Where is this going?
Well, to your point, the president's not going to probably want to do anything, despite the fact that there'll be a big push defund to delay it, defund it. But I think the American
So you think that
people,
effort is a waste of time?
I don't think it's a waste of time, but I don't think it'll be successful initially. I do think you have to keep the drums going, but I do.
What I'm asking you, would you shut down the government over? Would you attach that to
the continuing resolution?
Yeah.
I would, but I'm not running for re-election anywhere. So, but I would.
Would you, Dagan, do that?
Well, neither is the president.
That's a tall order, isn't it, though?
I think it would be bad. Myself, I think it would be very, very bad.
One thing I wanted to point out, though, you want to see what our national health care system would look like if it was single payer. Just look at New York City. Now, Michael Bloomberg's very concerned about what we eat in this city, how large the sodas are that we drink, the calorie content, the like. It's because the city has a city-run hospital system, and they bear the burden of higher health care costs. So they're trying to force and change behavior on the people of New York City for that very reason. So this is just the beginning of rationing. It's the kind of thing that you would see nationwide in a much bigger, more severe way.
I'm hoping things change because they just need to change. I'm hoping that some smart people figure out that businesses are just not going to hire that next person because of the mandates on how many people are hired. So,
well, I defer to all of you guys, the experts, and far smarter than I. All I know is the things that have been delayed are the things that are going to pay for this. The things that have been front-loaded and are going on as usual are all the goodies.
The things that have been delayed have all been for big businesses, right? Insurance companies benefit, big businesses benefit. The people watching the show, they don't. They're going to be paying those penalties right out of the gate. That right there is just yet another red flag.
And that, by the way, is digging a deeper financial pit. But we'll see how it works out. Unlike Adam, hope springs eternal. The same drugs as Adam. I love Adam dearly. Anyway.